Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. JVP, also known as the jugular venous pressure. So here in the JVP, there are many waves. So first we have the A wave. A wave corresponds to the atrial contraction. Then comes the C wave. C wave, it corresponds to the cusp bulging. C for the cusp. C for the cusp which bulges. The cusp bulging into the right atrium, RA cavity. Next we look at the V wave. The V wave, it corresponds to the venous return. Venous return to the right atrium. Corresponds to the venous return to the right atrium. V for venous return. C for the cusp bulging into the right cavity. Next is X. The X wave corresponds to the atrium relaxation. So X corresponds to the atrial relaxation. Then comes the Y. So this Y is nothing but the opening of the tricuspid valve. Opening of the tricuspid valve. So there is a prominent A wave. What does it indicate? A prominent A wave, that is corresponds to the atrial contraction. A prominent one, it indicates the tricuspid stenosis. And also there is a can also suggest pulmonary hypertension. Next, Canon A wave. Canon A wave, it indicates the complete heart block. Complete heart block, also it is known as a junctional rhythm. Now the absence of A wave. Absence of A wave, it represents the atrial fibrillation. Now looking at the large V wave. So V wave was nothing but the venous return to the right atrium. So the V wave, it represents the tricuspid regurgitation. Then looking at the sharp Y descent. The sharp Y descent is seen in case of the constrictive pericarditis. So Y was nothing but opening of the tricuspid valve was Y. So the sharp Y descent is seen in case of constrictive pericarditis. Then looking at the sharp X. The sharp X descent, X was corresponding to the atrial relaxation. So relaxation, the X, it stands for the relaxation. So here it is the case of the tamponade. So in case of tamponade and also the constrictive pericarditis, there is a sharp X descent.